Can you explain the rationale for the phase II NeoSphere trial?
The main goal of this study was that of ranking therapies and see whether additional pertuzumab to the conventional treatment could improve the results. Initially in terms of response measured at surgery, which is defined as pathological complete response because is described by the pathologist on the surgical specimen.
And can you explain the trial design?
The trial design was dedicated to this objective of ranking therapies, but at the same time we wanted to avoid the risk of negating a therapeutic opportunity to all women participating in the trial. And that is the reason why the same chemotherapy was at the end given to all patients, and that is the reason why all patients after surgery received the standard treatment of adjuvant trastuzumab for 1 year.
And what kind of patients were included in this trial?
In this trial we included patients with early breast cancer, and they were with tumors that can be defined as relatively large. Around 40% of them could be, strictly speaking, defined as locally advanced breast cancer, including a 6%, 7% who were with an inflammatory breast cancer, which is the worst form of advanced breast cancer. So, although early in terms of local regional distribution of the disease was already quite advanced.
This ASCO, you will present a pre-planned descriptive 5 years intention to treat analysis of this trial. What were the main findings with regards to the disease-free survival and the progression-free survival for the different treatment arms?
The first and most important thing is that no harm was done with the introduction of the new therapy, and that is reassuring. And this emerges both from the tolerability analysis that has continued after the surgery, as well as specifically on the cardiac safety of administering pertuzumab on top of administering trastuzumab and chemotherapy. The second observation is that the addition of pertuzumab to the conventional trastuzumab and docetaxel had translated in a somewhat better outcome later on, as if there were a carryover beneficial effect on the women who had achieved and received the pertuzumab before surgery. And that is obviously very important because it goes along with two main aspects. So one is practical. It is along the same lines as the results of Cleopatra and makes hope for the better in terms of the results of the affinity trial in the adjuvant setting. The other point is that it supports the concept that an improvement in pathological complete response at the end will translate into a measurable effect long term, and so supports the concept that drugs can obtain a preliminary approval based on that, and this will open the possibility of new drugs to patients without waiting for years before the conclusions of an adjuvant study.
What can be concluded from the results?
The results are exactly as I said, going in the direction of a benefit from pertuzumab and value the relevance of pathological complete response as a surrogate for long-term results. Okay.
Thank you very much.